Hi there, Andrew with Zang Physical Therapy here, and what I want to talk today about why you need to stay off prescription pain medication. And there's been a lot of press and media report regarding opioids and the addiction numbers and even the amount of deaths that have resulted from overdoses. And my wife just showed me an article last night in a local publication that was basically saying that we all need to take responsibility. And interestingly, they kind of left the medical community off the hook a little bit. They were putting a lot of pressure on government and the individual insurance companies to try to get people to, or for the insurance companies to support more physical therapy as an alternative for prescription pain medication. But for some reason, doctors got left off the hook. And this is not to say that the doctors are fully to blame for the issue, but they're part of the problem by giving people access to this medication, letting them become addicted, and then patients are then seeking out alternative means and other drugs as a result to get themselves to feel better. And if you didn't know this, the prescription pain medication, the opioids, your Percocet, your Vicodin, things along those lines, they're only designed for short-term pain relief, okay? And taken long-term, it doesn't block pain, it actually enhances pain, which is why you build up a tolerance and you need to take more and more in order to get that same kind of relief. So the best thing is to just not take it from the beginning. There are other alternative means, some over-the-counter stuff, your Motrin, your Tylenol leave can be helpful, and there are some other prescriptions that can be given. Not that you want to be on any prescription medication, but they're better than taking the opioids because it's just not worth getting addicted and all the other GI side effects that can come as a result of taking it in the first place. So for people who are living with pain or chronic pain, there are other solutions, be it acupuncture, massage, chiropractic, physical therapy. There are other pain management specialists out there that try to get people off these opioid medications, which is a great thing. Get them taking other things. They're doing pain stimulators. They're doing other procedures to try to reduce what people feel, and those are great alternatives and great options for people. But it all starts with not taking them in the first place. So if you are taking these medications, then by all means you want to talk to a doctor about how you can begin to step your way off the medication, because going cold turkey off the medication just isn't happening. Your body will not like it, and that can actually be dangerous in and of itself if you try to reduce too quickly. So again, if you're on this medication, talk to a health professional about how you can begin to get off the medication, one, and then two, the options that you have for treatment, such as physical therapy. There are lots of techniques that we can do ourselves and in conjunction with professions like psychology. And yes, I know there's a stigma attached to psychology and whatnot, but they have some really great techniques and methods that they can teach people so that they can actually reduce pain just by the power of thought. It sounds kind of hokey, but it is true. That if we can help people to understand why they're in pain and to begin to learn about why they experience it, they can begin to take themselves out of it. Again, it's really cool what they can do, so there shouldn't be such a stigma attached to it, because the psychologists that work with chronic pain are really great people and can really be helpful. So if you are somebody who's out there who's living with pain, wants to get off pain pills and get back to enjoying life, then let's have a conversation. Let's start talking about the ways that you can reduce your medication and become more active and become more healthy and enjoy life again. So whether it's with somebody like me, a physical therapist, or if it's any other provider, I'm all for that, because I want to get people off these medications, whether I'm the one who helps them to it or whether it's a peer of mine or any other profession like acupuncture, massage. We all have a stake in the game here in helping people to feel better and live better. So if you have any questions or comments, please leave them below. I'm more than happy to get back to you and continue conversation. You can email me anytime, andrew@zangpt.com. But I hope this message has been helpful for you, and have a nice day.